The first sign is to take stock of the color of your urine. What color is it? If your urine is too dark, or if it's dark in general, darker than you normally see it, it could be a sign that you're dehydrated. Now, what should normal urine color be? Well, it should be kind of clear, like pale yellow, almost like the color, like a light lemonade type color. That tends to be sort of a general normal urine color for most people when they've got good hydration. If your urine gets darker than that, if it's a darker, you really got to be very thoughtful. You could be dehydrated. Let me also say, though, dark colored urine could be the sign of something else, though. So no matter what's going on, just check in with your doctor about this, because you don't want to mistake dark urine for dehydration when it's actually something more serious. Guys, I'm Dr. Jen Caudle. We are talking about signs of dehydration that you should not miss. Along the lines of urine, is if you're not urinating as much as you used to urinate, okay? That can be a sign of dehydration as well, because your body may be trying to hold on to the fluids that it has. Let me also tell you, however, that decreased urination can be a very dangerous sign, or an ominous sign of something else going on with your health, your kidneys, etc. So this is another sign where I say, if you're not urinating as much as normal, first thing you shouldn't be thinking is, oh, I must be dehydrated. First thing you should think is, okay, let me just run this by my doctor to make sure nothing else more serious is going on. But decreased urination is often a sign of dehydration. Also, being thirsty. Thirst is a big sort of indicator that we are thirsty or need some hydration, okay? So also you can use that as a guide, all right? That's really important. Next thing is a dry mouth, all right? When our mouth starts getting dry. It's so funny because I went to go make this video and literally, I think maybe I thought about this topic because my mouth has been feeling dry. And I actually think it's because I have not been staying hydrated enough. So dry mouth can be a sign of dehydration. Although, like the other things, dry mouth can be a sign of something else too. I have a video on dry mouth, by the way. You should check that out. What causes your mouth to be dry, okay? Other signs that tend to be a little bit more serious and severe, you start getting headaches, you start feeling weak, you start feeling dizzy. Those are actually potentially dangerous signs, okay? When you start feeling that way, dehydration absolutely may be in play, but at that point, you really should be seeking medical care. As with some of the other symptoms I mentioned, you should call your doctor, but these are symptoms where I'd say, hey, you need to be like checking in with someone, absolutely. But they can be signs of dehydration. The other thing that we often find, the other sign that we often tend to see with patients who are dehydrated, especially like in a hospital setting, is what happens is our heart rate tends to go up, and our blood pressure tends to go down. Those are sort of natural compensatory mechanisms that our body tends to put in place when we are dehydrating. It's a way of your body trying to compensate for that. So that is something that we will often see in patients when they get to a hospital setting. And then the other thing that I wanted to mention is things like muscle cramps, okay? In addition to that sort of fatigue and feeling like, oh my gosh, I'm exhausted, you might actually get muscle cramps because of dehydration. There are plenty of other signs and symptoms as well that come with dehydration. I'm going to link a few videos here about like signs to tell, like if you're dehydrated, by checking your skin. There's something that we do called turgor, checking turgor pressure and capillary refill to see maybe hydration status. The other thing I want to mention too is that you can actually drink too much water. I have videos on this. I know it's kind of confusing about how much water to drink. I'll link a video here. By the way, if you're watching this on Facebook, you're not going to see linked videos. So just DM me about the videos that you want to see and I'll send you links. But on YouTube, they'll be linked. It sometimes can be hard to know how much water to drink. It's actually a relatively complicated calculation. It depends on a number of different factors. But suffice it to say, you can drink too much water, and that is absolutely the truth. So I want you to be very, very careful about that. Can actually cause coma, death, seizures, etc. Can be very dangerous. Guys, let me know if this was helpful. Share this video with other people. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator with her water, nonetheless. I do daily videos. Please like and follow my page on Facebook, on YouTube. Please subscribe to my channel. Click the little bell for updates. I'm on TikTok, WhatsApp, Instagram, etc. You name it, follow me there. Also, sign up for my free health newsletter at drjencaudle.com. Guys, love y'all. Stay hydrated.